Okay, so we did our anterior and our medial quadrants. Now what we're going to do is we're going to work on our lateral and our posterior quadrant. So again, uh, I'm going to take my video off so that I have enough working room for everything that I'm going to do here. Okay, sorry. Sorry, I had to deal with my screen a little bit there. Okay, so now we're going to look at the lateral compartment. So if you go back here and you notice the medial compartment, right? The medial compartment adducts the hip. Wow, my handwriting looks terrible on this thing. Anyway, the adductor is gonna the the medial compartment adducts the hip. What you'll see is that the lateral compartment is on the opposite side. So since it's on the opposite side, right, we're going to see that those are antagonistic muscles. So I usually draw arrows to help you see where the antagonistic muscles are. Lateral and medial are going to be antagonistic. The lateral quadrant, its innervation is a little bit more special. So on this video, I'm going to talk about it in the specialized term that it is fibular. So it is the fibular nerve. However, some of the innervations are going to be more special or specific, and that is going to be superior gluteal nerve, and then inferior gluteal nerve. Those are the two you want to think about. Okay, so we're gonna let's maybe do this so that we understand a little bit better what the innervation is. When I put an A on my number or a B on my number, it's going to reference which nerve I'm talking about. Okay, and hopefully you guys can see this orange. So remember, we're going to talk about abduction, abduct hip. These muscles do some rotation, but I don't want you to concern yourself too much with that rotation. It's very odd. It's very difficult. So we're going to think more about abducting the hip to help us with our synergistic effects. Like, I don't know, maybe we'll put arrows like that or something. And we're going to see that they're kind of more posteriorly situated on a human, but they are on the lateral side. Since they're on the posterior side of the human, we're going to think about the fact that they're attached to the backside of the coxa, in particular, the backside of the ilium. So many of these are going to either go to the sacrum or actually the back of the ilium. And the best thing on the back of the ilium is called the gluteal surface. So not all of them go to the gluteal surface, but you can see that the gluteal surface is a good attachment, a good proximal attachment for these. And then distally, they're going to come down and they hit the head of the femur. Actually, they hit some of the greater and lesser trochanters of the femur. So I'm just going to put plus femur, right? And a lot of you come and ask me, do I have to know these specifically? I mean, yes, you do, but you can also study it attaching to the femur. And if you knew the skeleton, you know that the greater and lesser trochanter is at the top of the femur where the head is. So you don't necessarily have to try to memorize everything in detail. If you already knew some stuff previously from the things you learned in class, if you didn't know those things, then yes, you'll have to go back and understand what are the specific attachments for those muscles other than the femur. Okay. So here, let's see, where did I end my numbering? At 14. So I'm going to start my numbering here at 15, just like that. And we're going to see that this big muscle right here, that big muscle right there is number 15. That is gluteus maximus. You should not get that wrong. Gluteus maximus is the easier one. This is the large torso model that you have in class, and I just snipped a picture of the hip area. So this is number 15 that they've cut off. Okay. And then we're going to see that I didn't actually get a great picture. Basically, up here, high up on the hip is going to be number 16. This is number 16. This is gluteus medius. So I like to use this hip model, this I'm sorry, large torso model here, because you can see how there's a superficial, there's a middle, and then there's, a deeper layer right there. So 15 and then 16. And that leads to number 17. Oh, I forgot my A's and B's. Damn. It's very late. I've had a full day and I'm doing videos for you guys. So forgive me if I get something wrong. So 15 is actually going to be 15B because that's inferior gluteal nerve in terms of its innervation. And then we have 16. 16 is actually going to be 16A because that's superior gluteal nerve innervation. And now let's go back and look at the cut stuff. Okay. So remember, this was 15B. You see how gluteus maximus is actually sitting inferior to this one right here, which is 16A. That's gluteus medius right there. And I know you're thinking it's not inferior, but it's coming like that. So it is. And this is coming like that. That's more superiorly situated. Let me just erase that really quick. So this is going to be 16B. So that's superior gluteal nerve. And then you see as we cut away gluteus medius, this is 17. And I'm sorry, did I say B? B. I should say A. Sorry. I know some of you are going to come and ask me these questions, which is great. 17 is also A. 17 is gluteus minimus. All right. Notice how gluteus minimus here does not go all the way up to the iliac crest right there. That is something that if we take off all of these things on the model, you should also be aware of this muscle here. That is gluteus minimus. It's the deepest of the three gluteal muscles, okay? And then the muscle that goes underneath that is going to be 18, and I'm not going to give that a letter because that's piriformis. Piriformis is innervated by the fibular nerve, not by superior inferior gluteal, okay? You know piriformis because on this model, there's this white strip, which really, it would be better if it were yellow. That's the sciatic nerve, okay? The sciatic nerve is going to go right underneath piriformis, always. If you're concerned about where gluteus minimus is nowhere near the sciatic nerve. Piriformis is underneath the sciatic nerve. On this model, so on this model that I'm talking about, this model, when you take off gluteus maximus, you'll see gluteus medius over here. And you can also see piriformis at the same time. So you see how this is gluteus medius, and gluteus medius will cover gluteus minimus all the way, but not piriformis, okay? Again, make sure you might not have an opportunity to look at the models again, but hopefully you have another picture or a video of it twisting so you can see that. Then the last innervation over here is we're going to cut that muscle right there on the hip in half. And this one I'm going to make actually what I made it number 8 previously. Whoop, whoop, whoop. So I'm going to call this 8 and I'm going to call it A. Okay. Remember, the blue part is also 8 right there. Remember, this is tensor fascia lata. So tensor fascia lata is innervated by 2 nerves and has to span both the anterior and the lateral quadrants. So we're going to see that this goes all the way to number 18, and it includes 8. Okay. What else was I going to say? Check the segmentation for tensor fascia lata. It should be L4 and L5, I believe, because it spans 2 quadrants and it's innervated by 2 nerves. All right. Otherwise, segmentation, know the basic segmentation, which I guess I should put on here. This is L5, S1, S2. And then if we come back here to femoral, femoral is L2, L3, L4. And we're going to see that obturator is L2, L3, L4. That's the segmentation I want you to know, okay? All right, last one is going to be red, and hopefully the red, ooh, the red's kind of rough. So I'm going to do kind of maroonish plus red. So what we're going to see is our anterior, right? Our anterior quadrant is going to have an opposite side, and that's the posterior quadrant. So when we do that, we can easily see our antagonistic muscles are going to have one action, and that action here, that action is going to be to extend the hip, and it's going to be flex the knee, okay? So since that's going to do extending the hip and flexing the knee, it has to span two joints. So you're talking about spanning the hip joint and the knee joint here. So that means you're going to see that these muscles come up to the backside of the coxa. The best thing on the backside of the coxa, which is not too high, is going to be the ischial tuberosity. And then since it's going past the knee, it has to actually, so these muscles either have to go here into the tibia or towards the fibula. I'm sorry, I'm just writing fast because I don't really feel like writing words, and that just is making my handwriting actually terrible. So let me write that a little bit better. Okay, and then I forgot the nerve. So the nerve here is the tibial nerve. There will be one exception though that I'm going to remember to put in here. And the tibial nerve, remember, is L5, S1, S2 innervation or segmentation. So the muscles we're going to start at number 19, labeling these muscles. All right. So you're going to see on this back side here, if you recall, this one's green, that one's green, and that one's green. Because if we go back to where our labels are, so that was 13, right? So we have 10 and 13. So this is number 10, and this one is number 13. This is adductor magnus, and this is gracilis right there. Then we're going to start to do our tibial innervation. So remember, we're going to see that this over here is vastus lateralis. So this was blue as vastus lateralis. Vastus lateralis was number 7. So I'm going to label this one as number 7. So we understand like what's happening in a sort of maybe in a 3-dimensional sense. On the lateral side, we're going to have this muscle that comes all the way down like that. Sorry about my red color. This is going to be number 19. This is biceps femoris, okay? And I'm going to do maybe an A and a B here because they have different innervations. So 19A is going to be tibial. Biceps femoris also has a short head, and the short head is kind of found over on this side of the model a little bit easier. It's very small, and on the distal side or inferior portion, that's going to be 19B. Okay, and why did I make that? I should have probably not done B, but why did I make that orange? It's because it's fibular. So 19B is equal to fibular nerve. That's biceps femoris, short head. Okay, everything else on the back is going to be tibial. So we're going to have 2 other muscles that are part of our hamstrings. So that muscle is the next one. You see how that muscle goes on top. This is going to be number 20. Number 20 is semitendinosus. And then we see there's a muscle back underneath semitendinosus. That's 21. That is semimembranosus. So my picture here is not that great because I can't see the medial side very well. But I'm going to come back over here to the medial side, and I'm going to help you again here. So that one is biceps femoris. This one's semitendinosus. So I just want to make sure I know what my numbers are. It was 19A. Whoop, sorry. So I have 19A here, and then I had 20, I'm pretty sure 20 right there. And then 21, you can also see you see that strip. Oh, sorry, that strip right there, that's 21. That's semimembranosus. These are ones you guys get confused. There's adductor magnus, there's semimembranosus, and then semitendinosus is the muscle on top of it. Remember, butts, biceps, right? Butts, biceps. Biceps femoris is on the lateral side. Semitendinosus is on the medial side, okay? So it's going to go from 19A all the way to 21. In my posterior quadrant. So you see those nice antagonistic muscles, okay? So check and make sure you understand tensor fascia lata, like its specific segmentation. Maybe I'll write that for you guys right here. This is L4 and L5 because it's spanning fibular nerve and femoral nerve, okay? All right, the next one I'm going to do is I'm going to do the leg.